Hi, I'm Dr. Obagi, and I want to talk about some of the more common growths of the skin that we see that are benign. One of the most common growths you're going to get are just typical moles. Now, there are different kinds of moles. So there can be flat ones, raised ones, dark ones, skin-colored ones. In general, moles we see all the time. As we get older, past the age of 35, 40, we'll start developing these other growths of the skin. We call them seborrheic keratoses. These are oftentimes raised. They still can be flat sometimes, especially if they're early, but seborrheic keratoses, these come about as growth spots, or I like to call them wisdom spots on the body. They very commonly can be on the back, on the belly, on the chest, but even the face. And these growths can also be darker to skin color depending on the person, and are completely benign, but sometimes can get annoying, especially if you pick and irritate them. So those can be treated by a medical professional as well. Another common growth we often see, especially on oil gland dense areas, particularly the face, are things called sebaceous hyperplasia. These can look like these clear to pink papules of the face that sometimes have like a ring of little tiny lobules creating them with a dimple in the middle. And those are just an enlarged oil gland that we oftentimes get from just an overactive oil gland, or an oil gland taking off and growing too much. But again, they're benign. However, if you don't like the way one looks, you can seek out a medical professional to help treat those. Other common growths of the face, on the nose in particular, we get these things we call fibrous papules. And this is a bundle of fibrous tissue with a mix of fibroblasts and collagen inside of them, creating this raised bump on the nose that sometimes is skin colored and just feels a little bit firmer to the touch than the rest of your skin. Those again can be treated by a medical professional. So we're here to help you. If you have any questions or concerns, come on in, we can take a look if you want to be sure that one of these spots growing on you is one of these lesions that we discussed, or if you want to do something about them.